Hello, everybody, and welcome. My name is Ashe McGovern, and I'm very excited to welcome you to the official launch of the U.S. Trans Survey by the National Center for Transgender Equality. I'm pleased to be here today to moderate our conversation of esteemed panelists, both as a legal and policy researcher at Columbia Law School and also as a non-binary trans person myself. On our panel today, we have Sandy James at the far end, survey project manager and lead author of the survey, Mara Keisling, Executive Director of the National Center for Transgender Equality, who is also an author on the survey, and Sharron Cooks, who's a longtime advocate and activist and community member in Philadelphia, and also the founder and CEO of Making Our Lives Easier, LLC. Sandy will be leading us through some of the most important data collected in the survey. Mara will talk to us about the policy implications of the survey, and Sharron will help ground us in personal experiences that the survey illustrates. The U.S. Trans Survey is a follow-up to the groundbreaking National Transgender Discrimination Survey, which was collected in 2008 and 2009 with NCTE in partnership with the National LGBTQ Task Force. The U.S. Trans Survey was able to ask more questions, deeper questions, and more often borrowed questions from federal surveys in order to compare federal data. The data we're going to be hearing about today describes significant mistreatment, discrimination, marginalization, and disparities in trans communities that they experience every single day. But it also highlights the resilience that our communities have been developing in the face of these barriers. So I'm first going to invite Sandy to start the formal presentation to highlight some of the survey's top-level findings and themes. Then we'll hear from Sharron and Mara about their experiences. About midway through, we'll give you some more detailed data findings, and then we'll have a further conversation. Along the way, you will hear some of the most important data relating to families, schools, workplaces, income, poverty, homelessness, sex work, violence, policing, prisons, access to public accommodations, and of course the many aspects of mental and physical health for our communities. This morning, the full report and the executive summary were posted online at ustranssurvey.org. Without further ado, I want to invite Sandy James, the lead author, to get us started. Sandy.
Thank you so much, Ash, and thank you to everyone for being here today. This is a momentous occasion. A lot of you know how much time and effort and work has gone into this, and many, if not all of you in the room, were an integral part of that. So thank you so much. And I just wanted to let you know that, of course, this was quite a large survey, quite a large data set, and so I will be touching on several findings, but there's plenty more for you to dive into when you get the full report. So just to give you a little background about the survey itself, this is the largest survey that's ever been conducted of trans people in the United States. We had almost 28,000 respondents, and we had respondents from all across the United States. We captured all 50 states, District of Columbia, several U.S. territories, and several U.S. military bases overseas. This was an adult survey, so there were transgender people in the survey who were 18 and over. I was offered in English and Spanish, and it was completely anonymous and offered exclusively online. And one of the things that is really important, I think, to note about our sample is that more than 1/3 of our sample identified as non-binary, which I think we'll talk about a little bit later, but I just wanted to say off the bat that that is going to be incredibly important for the kind of work that people do in their advocacy going forward, and that should not be we should not go in without saying that. So I just wanted to let you know that, over the thousands of data points we had, we saw that some key themes developed. Among them, there was pervasive mistreatment and violence. There was severe economic hardship and instability. There were harmful effects on physical and mental health. And all of these things were compounded by other forms of discrimination. And lastly, I'm going to touch a little bit on some of what the survey suggests about the positive effects of increased visibility and growing acceptance. On the subject of pervasive mistreatment and violence, almost half of the sample said because they were transgender, they had been verbally harassed in the past year. And almost 1 in 10 in the sample had been physically attacked in the past year. In our sample, we had 10% respondents that said in the past year they had been sexually assaulted, and almost half had been sexually assaulted in their lifetime. When speaking about economic hardship and instability, the numbers here are quite striking. our sample had 3 times higher unemployment rate than the U.S. population. And they're twice as likely to be living in poverty than the U.S. population. Additionally, when speaking about instability and the things that contribute to that, 12% of our samples said they had been homeless and experienced homelessness in the past year, and 30%, almost 1/3, in their lifetime. As far as harmful effects on physical and mental health go, these findings here are some of the most impactful in the survey. Our sample, with 39% currently experiencing serious psychological distress, was 8 times more likely to be experiencing that than those in the U.S. population. And our sample were 9 times more likely to have attempted suicide in their lifetime than those in the U.S. population. Moreover, we found that when people tried to access care, healthcare, they encountered more barriers. Of those who saw a healthcare provider in the past year, 1/3 said they had at least one trans-related negative experience, and that was anything from verbal harassment, physical attack, or being refused treatment by a healthcare provider. One of the overarching themes that we saw throughout the survey was that when you considered other demographics or other characteristics of respondents, all of these impacts were compounded. So among people of color, poverty was 3 times higher than the U.S. population. And among one of the most staggering findings is that although the sample overall had a much higher rate of those who were living with HIV, among Black trans women, the rate was 19%. And in the U.S. population, it is 0.3%. Additionally, when considering, again, other characteristics, people with disabilities were more likely to experience things such as unemployment. Almost 1/4 were unemployed, and almost half were living in poverty. And we also saw that there were major disparities by immigration status. So our undocumented respondents had high rates of homelessness. Almost half had experienced homelessness. And 1/4 had been physically attacked in just the past year, which meant in the year prior to taking the survey. But we did see things in the survey that might suggest that there are some positive takeaways from increased visibility and growing acceptance. Among people who were out to different groups, 60% said they had a supportive family. 68% said their coworkers were supportive of them as trans people, and more than half the respondents who were out to their classmates said that their classmates were supportive. So those are just a few findings. I'm just giving you a quick snapshot, and we will discuss a few more later, but we wanted to just start there.
Great. Thank you for that, Sandy. So we've now sort of gotten a snapshot of the themes and the numbers that the survey's kind of accumulated and published. Mara, can you ground us a little bit in what the policy stakes are here with the survey and the data that's been collected?
Sure, Ash. Thank you. Good afternoon, everybody. We know, I think we as a society know, and we as trans people know that there's a lot more visibility and acceptance of trans people than there used to be. And our policy agenda has been moving very quickly. But the survey is a good reminder that there's still a lot of work to be done. While there's so many good things to look at, so much progress being made, there's still tragedies and challenges happening every single day for trans people around the country. And the policy stakes couldn't be higher. We've always tried to be an extremely assertive policy advocacy organization, and there's data in here that shows us some of the things we really need to get into deeper and faster and better. And we don't have all the information yet about what the policy frontier looks like in the coming months, but we do know we have a tool now that shows lots of things that we need to be working on, and this will help with that advocacy.
Great. And Can we compare the survey data in this survey versus the National Transgender Discrimination Survey that was released in 2011?
Yeah, that's a great question, Ash. So the National Trans Discrimination Survey, which has been such an amazing tool for the community for a long time now, is a survey I think we're all proud of. It's one we did jointly with the National LGBTQ Task Force, and if I could just take a point of privilege and recognize the lead author of that report, Jamie Grant is right here. That report, when we were done with that study, I think we, as is the case in any survey research project, to say, well, here's a couple things I would do differently. And so we did those things differently this time. But there were a couple of big things. Well, first of all, the sample size is just so much bigger now, which I think is also a really good sign for the community. It shows there's more of us out. There's more of us who have access to the internet. There's more of us who are willing to step up and make our voices heard. But the other big thing we did, I think one of the things we regretted somewhat in the first survey was the comparability to the general population. Most of the questions we made up with trans people in mind and did it that way. This time with the USTS, we've done it very differently. The questionnaire design was done keeping in mind that we wanted to know about comparability to the general population. So what we did this time in most cases is take questions from other existing surveys, mostly that the federal government is doing, so that when you hear Sandy say it's 3 times more than the general population, we know that because the questions are more comparable.
That's helpful. Thank you. And Sharron, we've sort of talked about the numbers, we've talked about the policy implications. Can you ground us a little bit in your personal experiences and how this survey might make an impact?
Absolutely. Thank you, everybody, for having me. I think it's really important to bring home personal experiences when talking about the data reflected in the USTS. I've experienced discrimination and disparities everywhere from workplace discrimination to disparities in healthcare to violence and run-ins with the police. I can give everyone a brief example. Some time ago when I was working at a department store, I was a fragrance girl, and I was lucky enough to get that job. And when I got that job, there was a really nice gay man that worked in human resources, and he had assured me that he would keep my trans status confidential because at that particular time, I did not have my documents switched over. So at first I was seasonal, my performance was great. They decided to bring me on as regular staff. So upon my continuing to work at this particular department store, my trans status was disclosed. How, I have no idea. And that sort of started to create a hostile work environment for me. Co-workers and employees were mispronouncing me. They were using very transphobic language. I was restricted from going to places like the break room and the stock room, which really inhibited my work performance. And I had even had a coworker say to me that he would actually shoot me. So I filed several different complaints with human resources and with management, and ultimately I was fired. Now this was in about 2002, about 2001, 2002. So there wasn't any legislation in place in regards to gender identity discrimination. So I was terminated for, sticking up for myself. So that just gives you my own personal experience and in the advocacy work that I do with a lot of members of the trans community that are centered around workplace discrimination.
Thank you. Thanks
You're
for sharing
welcome.
that story. I mean, this survey really is a collection of stories, right? So it's really helpful to ground it in your specific experience.
Absolutely. I think it's a very useful tool that can actually reflect the real life experiences of a lot of people in the transgender community.
Thank you. And Sandy, can you talk a little bit about how Sharron's experience at work sort of is exemplified in the data or highlighted in the data a little bit?
Sure. When we looked at respondents' experiences in the workplace, there were high levels of mistreatment across the board. A high number of of our respondents said that they had either lost their job or been denied a job. They had faced all sorts of discrimination. They had faced violence from in the workplace. That was both physical and sexual assault in the workplace. And so that really does resonate with what our respondents said about the sorts of things they faced in the workplace and their limited recourse, really. And discussing how people file complaints, there's information on that and what the outcomes of those sorts of complaints were. And they really are exemplified by what Sharron has just said.
Great. And can you talk a little bit about, you mentioned one of the themes was that there's pervasive discrimination and mistreatment, but there are compounding factors that often impact particular communities even more significantly. Can you talk a little bit about what those factors are and what you found in the survey?
Yeah, definitely. When we were looking at respondents by different demographic or other characteristics, by and large, in most measures, we saw that the experiences were heightened. So one example I gave in the slide before was the staggering HIV number among Black trans women. But that happened throughout the survey and different health measures and in different employment stats, for example, and police interactions and experiences in prisons and experiences in all facets of life. So people of color certainly faced more pervasive mistreatment than some other respondents. We also saw that a staggering number of undocumented respondents really faced hardships that might seem insurmountable to most, and just unbelievable barriers. And certainly, again, people with disabilities, as I mentioned earlier. But in essence, our respondents face some sort of discrimination. And if there were other compounding sorts of biases that already existed that we are very much aware of, all of those experiences were heightened. And that was certainly played out throughout the entire survey.
Great. And you mentioned that non-binary people. So non-binary people meaning people who don't identify as men or women exclusively or sort of identify outside of those categories or in between. You mentioned that about a third of the survey respondents identified as non-binary people. Can you talk a little bit about why that high number is so notable?
Well, there's a few reasons. I believe I'm correct in saying that this would be the largest number of non-binary people who have responded to a survey and identified as such. That's incredibly important, as I mentioned, for the kind of advocacy and the work that we all have to do going forward. And if we truly to make an inclusive work, we have to be aware of needs that might be different between binary trans folks and non-binary trans folks. And then also, I think it's important to highlight that when looking at different experiences of binary and non-binary trans people in our sample, many of the experiences were the same. They both faced high levels of discrimination and mistreatment, and in some cases, it was worse for people who were non-binary. So I just think it's an incredibly important piece of the survey that we start to really look at our advocacy and how what we're going to do going forward to address all of the things, the commonalities, the things that are the same across the board, and the things that might require different types of advocacy.
Great. That's really helpful. Thanks. So now that we've sort of gotten a broad overview and touched on the themes a little bit, Sandy, if you could walk us through some of the specific numbers and specific topic areas, that'd be great.
Yes, and again, I just have to remind you, this is thousands and thousands of data points, and it was incredibly hard to really draw some out for this release today. But I just wanted to touch on some other key findings here. So in regard to family life, a lot of people in our sample said because they were trans, they had faced violence from their family members, or they were kicked out of their home, or they had to run away, among those who said that they were out to their immediate families. But there was something that we saw that was striking, and it was family support and what a difference it made. So if you observe here that among people who had supportive families versus those who had unsupportive families, if you look at those who experience homelessness or attempted suicide or were experiencing serious psychological distress, the numbers were lower. Now, that's not to say that they were zero, of course, it's important to acknowledge that, but this certainly points to family support making quite an impact. And we also looked at identity documents and access and how many people had been able to update their identity documents. And 11% of our sample were able to update their name and gender on all their IDs, but more than 2/3 were not able to update their name and gender with their preferred, their ID with their preferred name and gender. So that is a very important finding. And we also found that one of the main barriers to that was cost. So among people, it was about 1/3 of people in our sample who said that they either did not update their name or their gender due to affordability. And also 1/3 of our sample indicated that when they showed ID that did not match their presentation, they faced various forms of discrimination, from verbal harassment to assault. So these are also findings that are incredibly important. With regards to health insurance and health care and access overall, about 1/4 of the sample had experienced some kind of trans-related health insurance problem. That could be being denied coverage for some sort of treatment, and could even, whether that was trans-related or even routine health care. Almost 1/4 did not seek health care when they needed to because of fear of mistreatment. And 1/3 of the sample did not seek treatment when they needed to because they could not afford it. When looking at experiences in schools, and particularly looking at kindergarten through 12th grade, of those who were out or perceived as trans in school, more than half had been verbally harassed because they were trans. 1/4 had been physically attacked because they were trans, and 13% had been sexually assaulted in school because they were trans. And because of this sort of mistreatment, 17% were forced to leave school because the mistreatment was so bad. There were also similarities in the findings in higher education, where those who were out or perceived as trans in higher education in an institution such as college or vocational school, 1/4 of them reported that they had been verbally, physically harassed or sexually harassed. When turning to the workplace and looking at employment, 16% of the sample said that because they were trans, they had lost a job among those who had a job. And 1/3 who had held a job in the past year had also encountered some form of discrimination, and they had been fired, denied a promotion, or faced other mistreatment. And included in that 30% is the 15% who had been verbally harassed, physically attacked, or sexually assaulted in the workplace. We're looking at housing and homelessness and shelter access, and 1/4 of the sample said that they had faced some sort of housing discrimination or instability, and that ranged from being evicted from their home or being denied an apartment or a home. It also includes those who have experienced homelessness in the past year. More than 1/4 had avoided shelters for fear of mistreatment. More than 1/4 of those who had been homeless in the past year. And of those who had gone to shelters, 7 in 10, 70%, reported mistreatment because they were trans. When looking at experiences in sex work in the underground economy, such as in drug sales or other activities that are currently criminalized, 1 in 5 said that they had worked in the underground economy at some point in their lifetime, and almost 1 in 10 had in the past year. 12% of the people who had worked in the underground economy had done sex work for income. And 86% who had interacted with police had been harassed or attacked or sexually assaulted or mistreated in some way, either while doing sex work or while suspected of doing sex work. in the sample, we found that there were a high number of police interactions, and in the past year, more than half of the sample had reported some form of mistreatment during police interactions. And of that 58%, that included verbal harassment, that included physical assault, sexual assault. It also included being forced to engage in sexual activity to avoid arrest. And overall, more than half of the sample said that they felt uncomfortable seeking help from the police if they needed. When it comes to respondents who had been incarcerated in the year prior to completing the survey, almost a quarter of those individuals had been physically assaulted by staff or other inmates, and 1 in 5 had been sexually assaulted. This is more than 5 times the prevalence of this occurrence of sexual assault by prison staff than in the U.S. population, and 9 times more than sexual assault by other inmates in the U.S. population. When examining experiences in places of public accommodation, there were high levels of mistreatment. Almost a third of the sample said they had been denied equal treatment or service, verbally harassed, or physically attacked. These were highest that we found in interactions in public transportation, in domestic violence shelters, and in substance treatment programs. And when looking at experiences in restrooms, and I think it's very important to note that this survey was conducted in 2015, which was prior to much of the national conversation about bathroom access and the heightened scrutiny that trans people are now facing in accessing bathrooms. Almost 1 in 10 said they had been denied access to a restroom by somebody. More than half had avoided using the public restroom for fear of confrontation. And about a third of the sample said that they routinely limited the amount they ate or drank to avoid using a restroom. So again, there are thousands of data points here, and the full report is a few hundred pages long. But these are just some of the findings that we wanted to speak about today and hopefully start dialogue on. And so at this point, I'll turn it back over to Ashe.
Great. Thank you, Sandy. So now that we've again heard more about data, Sharron, I want to turn to you. It seems as though the theme is that discrimination, mistreatment, and harassment is something that trans people experience in all facets of their life and across the lifespan, right? Including as young people. Can you talk a little bit about your experiences as a young person in school and with your family and how that's impacted you today?
Sure, absolutely. So just for starters, let's take bathroom access in schools and education. So when I was a young person, a senior in high school, I tried several times to utilize the girls' restroom so I could go to the bathroom, at which time I was repeatedly suspended from school. I was constantly disciplined to the point where the school administration had made it so blatant, their discrimination so blatantly obvious, that 6 months prior to me graduating, I actually dropped out of school. So that just is one example. So 10 years, so that was in like 1998. So then like 10 years later in like 2008, I ended up getting my GED. But you see the delay that had on my life because I wasn't able to access the restroom that corresponds to my gender identity when I was in high school. So that, as the data illustrates, that these types of occurrences are happening today with a lot of trans young people. And what we can do is utilize the findings from the U.S. Transgender survey to educate people around those pieces so they won't have their higher education delayed like I had mine delayed. So that's just one story around why access to restrooms is very important and how access to restrooms can actually be, when denied access to restrooms, that can actually be a hindrance for someone to live a successful and full life.
Yeah.
Ash, can I
Sure.
weigh in on that? And Sharron, thank you so much
Absolutely.
For sharing that with us. I think one of the challenges we have right now in the United States while we're having this bathroom conversation is what it means for trans people. I often hear, like everybody else in the media, they'll say this law lets trans people use the bathroom of their choice or not the bathroom of their choice. It isn't that easy for us. And as Sharron's story illustrates, if a child can't use the bathroom at school, they can't go to school. We saw 17%, Sandy just showed us number, 17% of the folks, the harassment and such was so bad they had to leave school. A lot of that is around lack of access to bathrooms. And the truth is, if I'm not allowed to use the women's room at work, I couldn't have a job. I couldn't have an income. This is not about some sort of self-indulgent choice people want to make. This is about our ability to fit into society, to have jobs, to go to school, to just be people with full dignity in the United States. So thank you very much, Sharron.
You're welcome.
Thank you. That's a helpful context. And Sharron, speaking of sort of schools and being a young person, can you talk a little bit about your journey with your family and their level of acceptance and how that's impacted you?
Absolutely. And thank you for asking me that question. So I have a very unique experience. So my experience is full circle, but when we talk about 2 decades ago, there were not tools. There were not tools out there for my family to have access to that allow them to understand what it is like to have a transgender family member. So because of those misunderstandings and not knowing, there was a lot of family rejection in that area. And because of that, I felt very isolated. I felt emotionally unsupported. And, that's very, very scary for a person. And I think utilizing the USTS is a very good educational tool for trans parents, for educators, for activists to utilize to say, hey, these are the areas in which we can look at so we can be more supportive of our transgender family members, so we can be more supportive of our transgender neighbor. So I have been very fortunate and very blessed to have a full circle experience, I like to describe it. So whereas in my younger life, my family weren't really educated about trans issues, and now that there's more access to education around people in the trans community and things that we face, and now that we have data such as the USTS, my family is exceptionally supportive. My mom, for Transgender Awareness Week, she was like, oh my gosh, I wore my Transgender Awareness Week pen, and nobody at work asked me why I was wearing this pen, and I was like, oh my God, it's just awesome. So it just goes to show you how you can start out at one place of rejection and not understanding. And when we talk about rejection, a lot of times that is around not knowing or not understanding, and people have a fear of that. So going from that to, being, fully supported and fully acknowledged in my gender identity by all members of my family, even my very conservative, religious family members are very respectful and accepting. So my message is to everybody that you may start out in one place feeling rejected and isolated from your family, but you can definitely move into a place of understanding and acceptance, and sometimes that just takes time.
Mm-hmm. Thank you for sharing that. And
You're
sort
welcome.
of the power of being seen, right?
Absolutely.
Yeah. Sandy, I'm wondering if you can talk a little bit related to Sharron's experience about how family acceptance does actually impact people. You talked about it a little bit in the slides, but I'm wondering if you can elaborate on the positive impacts that family acceptance has on people's lives.
Yeah, I just offered a little bit of a snapshot earlier. There were just 3 measures that we talked about. but that sort of pattern was seen everywhere. So among people who said their families have been supportive, their lives and the experiences they had were just very different. There were much lower, of course, levels of experience in homelessness, but also you could see in educational attainment there were differences. There were differences in income level. There were just all sorts of things that spoke to how important family support is in someone's life. And when comparing people who said their families were supportive to those who said they were unsupportive, it's very clear to see the pattern there. Family support makes a huge difference in someone's life overall, and how full of a life they're able to lead.
And if I just may interject for a second, that is definitely the case, because going from not having a supportive family, being a high school dropout, to, having really great relationships with government officials, community activists, community leaders, obtaining my Bachelor of Arts from Arcadia University. So it just goes to show you how you can go from one point to another point when your family starts to support you and your community starts to support you. From firsthand experience, how valuable that family acceptance and support is, and how it can definitely enrich your life.
Thank you. That's really helpful. So sort of related to that, two of the numbers that stuck out to me a lot were sort of the measures of serious psychological distress and also the high rates of attempted suicide. Sandy, I'm wondering if you can talk a little bit about how you measured serious psychological distress and what we can learn from that.
Yeah, so the measure of, throughout we talk about currently experiencing serious psychological distress, and that means that in the month prior to taking the survey, people were experiencing seriously psychological distress. That's based on the Kessler-6 scale, which is a widely used tool for assessing mental health, and that is used in government surveys and is used across the board to be able to measure how people are doing, which is why it is so important that we were able to use that. It's a battery of questions that people answer about how they're doing on a daily basis with different experiences with mental health, and how much those things are impacting their life. So it is incredibly important to be able to, for example, look at the National Health Interview Survey or something of that nature, and be able to say that across the board, people in our sample were just experiencing much higher levels of serious psychological distress. And you should remind me of the second part of your question.
What was the second part?
Yes, that's
attempted suicide.
That's so one of the things that people took away from the last survey, one of the most I think impactful numbers, one of the numbers that people talked about the most was the rate of attempted suicide in the lifetime. And so one of the things that both the NTDS authors last time and many people who've done work since acknowledged was that there was not a battery of questions that really assessed that in the way that might truly get to some of the other behaviors, suicidal behaviors and thoughts. So in this survey, we did do that. We did get to those. We were able to parse out people who had seriously thought about committing suicide, people who had made plans to commit suicide both in their lifetime and in the past year. And that number, which is 40% versus 4.6 in the U.S. population of attempted suicide in a lifetime, is after giving all the opportunities to talk about the different ways in which people had thought about suicide. And so it's really important to be able to use that once again and be able to measure it both in the past year and in a lifetime in a way that we can compare to the U.S. population.
Yeah, can I add something that's really great about this survey is we expect researchers to come to us and say, we'd like the data set. We'd like to look more into the suicide question, the serious psychological distress question, or the economic questions. We simply, as an organization and as a research team, are not likely to be able to get to everything because this is such a rich set of data. But having other researchers come to us, not right away, give us a couple months. but as researchers, as they did with the National Trans-Discrimination Survey before, some researchers came to this with research questions that were much different than we had anticipated, and they did their own research with our data, which we really loved and think is for the good of the order.
Great. And I'm wondering if this is sort of a question for anybody, but if you can talk a little bit about the rates of attempted suicide, the serious psychological distress, and how those numbers interact with levels of health insurance enrollment or healthcare access generally. Just if you could talk about that.
I'll jump in there,
That'd be
Ashe,
great.
if you don't mind.
Yes, please.
So when we talk about healthcare and we talk about the trans community, there are a lot of disparities there. And from my own personal experience, I have experienced disparities. So I'll just give you a small example of that. So I was living in Philadelphia at the time, and I moved to Dayton, Ohio, which is very different from Philadelphia. So there was very different. So everyone in the room knows that it was very different, okay? So you're picturing it right now. So when I was in Philadelphia, I had already seen a doctor who had me on a prescribed medical regimen. When I went to Ohio, I had run into medical care providers that never had any experience with the transgender community whatsoever, let alone having a transgender patient. So after, I guess, the doctor figuring out and bringing in a whole other team of doctors to poke and prod at me, which was an extremely invasive and traumatic experience. The doctor, mind you, who had never had a trans patient before, was like, oh, these dosages, I'm surprised that you're not dead taking those dosages. But the thing about it is that these were dosages that were prescribed from a competent doctor that was used to dealing with the transgender population in Philadelphia. So when you look, just geographically where, Philadelphia is and where Ohio is, we need to do more work in not just around healthcare, emotionally, mentally, and psychologically for trans people, but there are areas in our country where people don't have competent doctors, where people don't have access, and I think educating, medical providers around what is trans competency, how to engage sensitively with the transgender community as far as their health needs are concerned, and servicing the whole person. So the data reports talk about a lot of psychological issues that have to do with being trans and those experiences, and having doctors that are aware of that and are trained and competent enough to know that this is a part of the trans experience. So we need to take all of this into consideration when we are providing them with health care.
Yeah, can I just follow up on that a little bit? That's exactly what the data reflected. And if you think about one of the data points that I believe I shared, of those who had actually accessed healthcare and gone to a health provider, about a third of them said that they experienced some form of mistreatment. Competency in healthcare is incredibly important. Being treated as a whole person in healthcare is incredibly important. Shouldn't have to say that, just really shouldn't have to even say that, but it's incredibly important. And so if a trans person, when they need care, and this is not exclusively transition-related care, this is any kind of care, if they are faced with doctors or other healthcare providers who don't know anything about who they are and are not doing the work of figuring out how to properly care for trans patients, you're just re-traumatizing that person. And so there is a lot of interplay between access to health care and higher levels of serious psychological distress. And another point of that is even those who had health insurance is not that useful if you're denied coverage for things. So just having health care and access to health care and health insurance is not enough. We need competency among insurers. We need competency amongst healthcare providers so that trans people can interact in the world in the way that people should be able to.
Absolutely. And from not having a competent doctor in Ohio, I went like a whole 8-month stint without being on medication because that experience was extremely traumatizing, and not having the access to the medical care that I needed, that impact on my life was some of the darkest times. So it's really important that we have competent medical care providers that are educated around the needs of trans-identified individuals.
Yeah. Ashe, can I add to that?
Sure.
A number or two numbers that Sandy showed that I think were really interesting on this conversation. One was 23% of trans people had skipped going to getting medical treatment in the last year because they were afraid of being mistreated because they were trans. But really importantly, 10% higher, or 33%, didn't seek medical treatment because they couldn't afford it. When people ask me what's the biggest issue for trans people, I always say it depends which trans person you ask. Because for some trans people, poverty is the most important issue. For some trans people, it might be something about their identity, or it might be family acceptance, but for some people it might be racism or poverty. And I think we have to keep that in mind. And when we look at the serious psychological distress, which is not my expertise, so I don't want to put too much on it, but I know that the 39%, there are people feeling stress about different things. For some people, it is about disrespect. But tying it back into your actual first question to me about how this all relates to our policy advocacy, it's why we at NCTE really believe that we can't have an effective trans advocacy movement or organization unless it is anti-poverty and anti-racist and pro-immigrant, pro-woman, pro-worker, pro-disability rights, because trans people need all of those things. The psychological distress we're facing, the disrespect we're facing is from lots of different directions, and we have to rise up and stand up to all of those things and to fix all of those things.
Yeah, thank you for that. Yeah, I think the poverty numbers were some of the starkest numbers. I don't know, Sandy, if you want to talk any more about the disparities between communities in terms of higher rates of poverty versus not, but that stuck out to me significantly.
Well, yeah, I mean, overall in the sample, it was almost twice as high. So the rate was 29% in the sample versus 14% in the U.S. population. But when you looked at different groups, such as people of color, it was higher, up to 3 times higher. Then again, when you consider other characteristics, the numbers were higher. And I think just following up on what Mara is saying is that there is no single issue, I think, that was affecting a respondent that just stood out. Well, I'm fine in the realm of healthcare, but I really would like a job. Because there's a lot of interplay between these things, right? So poverty is contributed to by unemployment and high rates of unemployment, access to healthcare. Affordability, of course, once again, we can tie that back to poverty and unemployment. And so definitely across the board in the survey, we saw that respondents were impacted by many different things. And it is really important to talk about those additional types of biases that are already at play that make it harder for people of color, or people with disabilities, or people with different immigration statuses to be able to thrive and even just basically survive. So it's really important to dig into what these kinds of numbers mean. What does it mean that trans people are facing poverty levels is twice as high, and what does it mean that people of color are experiencing even higher numbers of poverty? We really have to think, and I turn to Mara and other advocates and other policy people and individuals and educators and parents to really start to think about these things and how we can address these sorts of needs.
So if I could just jump in really quick. So when we talk about poverty and unemployment, particularly in the trans community, and especially for trans women of color, when you are discriminated against in the workplace, and you are facing alarming rates of poverty, a lot of times, and from my own personal experience, the sex work industry is kind of the only option that you have to kind of have a source of income to be able to seek the necessary medical care and medical treatment that you need, to be able to have affordable and stable housing, to be able to just provide yourself with very, very basic needs. And I think it's really important for people to know that, sex work is not your only option. There are other options, but we really need to utilize this report, and we need to utilize it in a way that we can start educating people so we can get a lot of trans-identified people out of poverty, so we can get them adequate jobs, and not just adequate jobs, but gainfully employed jobs, so they can live in good areas, and so they can, pay their taxes and be contributing members to our society and be productive members to our society. So that's really important. So, it affects people in various different areas. And I think we're a little short on time because I'm getting flagged back there, so I'm just going to turn it back over to Ashe.
No, I think you should just talk the whole time. But speaking of this, and thank you for sharing your experience.
Absolutely.
Another number that stuck out, and so many do, was the experience of trans people of color, particularly trans women of color, interacting with police, and the violence that trans women of color in particular experience both in prison and just by the police generally, either for engaging in sex work or just being perceived as engaging in sex work. Can you talk a little bit about your experiences interacting with police and how that's sort of gone?
I mean, I have several experiences. Which one do you want? So I'll just give you two really quickly. So there's one. So in Philadelphia, Pennsylvania, for all of you who haven't been there, there's like an area where like all of the gay clubs are. We call it the Gayborhood for short. It's in Center City. Everybody hangs out there. So, quite some time ago, that area, you could be arrested for just being trans. So I myself, as well as a lot of people that I know who are trans, were, just hanging out, being free. A lot of people had run away from their homes. A lot of people were put out of their homes. So we were just like literally like on the street. So police vans would come and they would do what they call a sweep and just sweep us all up and throw us in the back of, they call it a paddy wagon, in the back of a paddy wagon, and we would literally be detained from like 36 to like 72 hours, like in a police cell, all the while being called very disparaging names that I'm sure everyone in this room could use their imagination, but they were extremely transphobic, mispronouncing people, not using their preferred names. So that's just one example. And then another example is when I was in a domestic violence situation with my partner at the time, and I was the one that was injured, and the police were called, and I was actually the victim of the violence. But as soon as my trans status was disclosed by my partner at the time, the police instantly were not very nice. They were not very kind. They were very nasty. I had to walk around with once we got to where I was supposed to be, people were like, why aren't you wearing shoes? And I'm like, I have no idea. Why don't you just ask the police officers? So that's just some of the experiences that I have had around police harassment, wanting the police to be there when I needed them to intervene on my behalf, and they didn't do that, and it was opposite. And there has been experiences where I have just been out in certain areas, and the police have just rolled up and said, y'all are all coming with us. And so, yes, it's very prevalent in the trans community. Yeah.
Yeah, thank you for sharing that experience.
You're welcome.
And Sandy, I wonder if you can talk a little bit about the data that, again, speaks to Sharron's experience that you collected on both policing and the experiences of trans people in prison.
Yeah, well, we wanted to look into, the phenomenon. I don't know if that's not really the right word, but, walking while trans and people being, as Sharron said, just rounded up. And whether that be looking into did police use evidence of a condom in your pocket or something of that nature to suggest that you were engaging in sex work or anything of that nature? And so we saw high levels of police interactions in our sample, not just among those who had been doing sex work, but there were a lot of instances in which police assumed that people were doing sex work. And a lot of things come out of that, whether it be an arrest. Now people have an arrest record, and now you have that to grapple with. So we most certainly saw that. And I should also mention here, beyond the numbers, we collected I'd say an unbelievable number of stories after people took hours to complete the survey. They also then submitted their stories, and this sort of thing was said over and over and over again, where the police were called on their behalf, and once they heard they were trans or found out in some way, the tune absolutely changed, and all of a sudden now they were the perpetrator, and they were now being victimized by the police. So this is played out throughout the survey in great detail. If you look at different measures that we asked about these sorts of things, it becomes very clear that these interactions with law enforcement are harmful and are perpetuating the kind of very negative experiences that trans people are having in their lives.
Thank you. So we're running out of time, but I do have one final question that I'm hoping that you all can answer, which is, what is the most significant takeaway from this survey, or what's a significant takeaway that you would like to share with people who are watching this? And then also, what do we do now, right? What do we do with this information? How can activists, advocates, educators, and just regular people use this information to take action? That's for everybody.
Oh, well, I'll go first since I'm sitting closest to Ashe. I think that it is very important to, I'm very involved with Equality Pennsylvania, which advocates for the rights of all LGBT people, inclusion and diversity, and this would be a great tool to utilize to address certain issues that the trans community is having, and try to come up with some transformative solutions that are more supportive of trans people, so they don't have the same obstacles and barriers to living a full and successful and accomplished life like I had. They could get it a lot sooner instead of having it be delayed. So I think this is a very useful tool for anyone who wants to educate people around trans issues and address those issues moving forward.
So I'll go next. I think for me as a research person, but also as a human being, I think it's incredibly important for people to stop making it seem like trans people are those people over there. I think the media does this a lot, where it seems like trans people are some sort of people that no one engages with or interacts with. But one of the things that I think is pretty neat about the survey is that our sample did very much reflect the geographic distribution of people across the United States. So trans people are your neighbors. They're in school with you. They're not some phenomenon that people read about in books. And I don't really know a better way to say it than that, which is that this should be an educational piece for everyone. It's not just for policymakers. It's for your parents. It's for my parents. It's for everybody, so that you can see that, almost 28,000 people stood up. That's a staggering number for any survey for people to respond to. And I think the reason why we had so many people respond is because trans people wanted to share stories and wanted to be heard and wanted to be acknowledged and wanted the rest of the United States, and dare I say it, the world, to take notice that it's not about a very small percentage of the population. Trans people are everywhere, and I think that society needs to start acting accordingly. So I want educators to start protecting trans children. I want lawmakers to start protecting trans people as they want themselves to be protected. And I might be going a little too far into the policy realm, but I'm just speaking as a as a person who wants to live life in the fullest way possible, every single respondent in this survey also wants that, and that's why they spoke up, and that's why they took the time to complete this. And that's what we need in every facet of life, for trans people to be respected as everyone should.
Well, that's one of those things I hate to follow, but I will. Thank you, Sandy. That was, I associate myself with everything Sandy just said. I will give you my answer. I just want to take 30 seconds just quickly to thank the research team. Sandy James, Maya Nanafi, and Lisa Mote, who are in the room, Sue Rankin, and Jody Herman, who are not in the room. I want to thank the whole NCTE staff, the Design Action Collective, who has designed our book, the National LGBTQ Task Force for starting this project overall with us 8 or 9 years ago, Jamie Grant, who worked on that. I'm probably forgetting people. Oh, the funders who made this possible, the individuals and the foundations that made it possible for us to do this.
Sorry, can I just interrupt? And this is really important to me because I see some of the people in the room. Everyone who was an intern, a volunteer, a fellow, someone who took time and effort and energy, thank you for being here. Thank you for everything you've done.
Thank you. From me, they were next on the list, as was the Trans Advisory Committee on the survey, and then 28 almost 1,000 people who took the survey. That was really wonderful. And I'll just say, this is an amazing tool. The National Center for Transgender Equality wants everybody to take this tool and use it as you will, as long as you use it, fairly and correctly. There is a lot of work to be done. There's just so much remarkable work that we can do together. We have all been doing great work. I really want to say again, I know I said it earlier, but I cannot stress this enough. The most important work that I think we do as trans people and as allies and as families is to educate the people around us. It's when we educate our families and when our families educate our neighbors and when we educate our coworkers and our classmates, that is really what's moving us ahead. That's what's going to make us safe eventually. Take this tool, use this tool, let us know how we can help you. I'm so thankful for everybody who was involved in this survey. So thankful to Sharron and Ashe for participating with us today, and of course Sandy, but you already got a thanks. Sandy, I owe Sandy like a big pile of thanks. We'll deal with that all later. So thank you all so much for me, and let's use this survey for good things.
Great. Well, thank you to all the panelists and to all you for coming out, and please make sure to check out ustranssurvey.org for the report. Thanks all.